hospitals. So without wasting time, please demystify the complexities and then we begin off the discussion.
All right, thank you so much. So what is asthma? By definition, asthma is a disease of the airways. Airways means the small tubes that transmit air. I have some cartoons here that I came with. Just imagine these are tubes that, you know, move air all the way from the throat down to the deepest parts of your lungs. So the small airways, that is a part that asthma affects. And what happens in asthma? So asthma is a variable disease of the airways, but at the core of that is chronic inflammation of those small tubes, hyperresponsiveness of the tubes, and also variable expiratory airflow limitation. So I've spoken a lot of English, but I want to make it a bit simple. Chronic inflammation, what does it mean in light of asthma? It means that this layer that you see here inside the tubes that transport your air is inflamed most of the time. So it comes from a beautiful color to something that looks angry. You can see the difference. And then what does it mean? Hyperresponsiveness, what does that mean? It means there is an exaggeration of response to the daily things in the environment. It can be colds or other triggers that we are going to talk about. And what does variable airflow limitation mean? It means that there can be a blockage of the airflow, but when you give the right treatment, it opens up. That is the variability in terms of the definition. So asthma has various presentations. You can have cough, you can have wheeze, you can have shortness of breath, but you can also have chest tightness. And those things happen to the same individual at different times and at different intensity. In summary, that's what we are talking about.
Excellent. I have been able also to learn using this model. Now, of course, we want to explore what could be the risk factors before we go to the pathophysiology.
So in terms of risk factors, because asthma is one of those diseases in the group of allergy-related diseases, so from your nature as a person, if you're made in such a way that you react differently to certain things in your environment, your airways can also react to those things in the environment. So genetic predisposition is there. And then with that in the background, things in the environment find you and make someone who is genetically susceptible respond the way they respond in asthma.
Excellent. Now, we want to talk about the risk factors. What could be those, or from the genetic factors? But can it be spread from one person to another?
Not really. Asthma is not contagious, and it can affect children. I think one of the biggest things is it's impossible. This is a child. There is no way even children can be affected. And in terms of maybe risk factors can be to an attack, but generally for risk factors, it's a genetic predisposition that is most important. And then the environment in which you're living in. If you're living in an environment with your potential triggers or allergens, then you can end up with a manifestation. So maybe we can dive into those triggers if you don't mind.
Let's talk about them.
So we talked about chronic inflammation, meaning your air tubes are angry, like the model that I showed you earlier. So, but what makes them angry to the extent that you come to the hospital? Those are the things that can either be allergens or can be irritants. And some of the allergens are things like living in a place that has mold. It can be pollen, especially from seasonal plants. It can be dust mites, those people who don't know how to clean their beds. They're tiny living things that are in your beds, in your pillows, in your blankets. You can have pet dander, those people who keep cats. They're things that fall off the pets that can trigger you. And so many other biological things like cockroach poo, rat urine, if you're living in a place that is not well cleaned and it has those vermin living with you. So those are some of the allergens in the environment. But there are also other things that are irritants. For example, pollutants. You can smell smoke and you start having manifestations of asthma. Other irritants can be like dust. You can have lime. You can have other triggers that are specifically not falling in those groups, like having a cold, what people call upper respiratory tract infections. Those are the commonest colds that everyone has at least once a year, or even more often than once a year, especially for children below 5 years. So those things in the environment, in someone who has susceptibility, when they come together, we can have the things that we talked about: the cough, shortness of breath, chest tightness, and even wheeze in a child or an individual with asthma.
Wow. Thank you so much, Dr. Namuli. You are so quick when you came to the predisposing factors. In the Uganda today, where are we standing in terms of a few statistics?
So in terms of statistics,